Welcome to the MRCS Bites session on testis. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbites.com. What is the blood supply to the testis? The testis is supplied by the testicular artery, which arises directly from the descending abdominal aorta at the level of approximately L2. The explanation lies in the fact that the testis develops high up on the posterior abdominal wall early in embryonic life. As it descends into the scrotum during development, the testis carries with it the same blood supply that it received whence it was positioned on the posterior abdominal wall, i.e., from the aorta. What is the venous drainage of the testis? There is asymmetry between the two sides. On the right side, the testis drains by way of the pampiniform plexus into the inferior vena cava, but the left testis drains into the left renal vein. This may explain why varicocele are more common on the left side. What is the lymphatic drainage of the testis? As a general rule regarding lymphatic drainage, superficial lymphatics, i.e., in subcutaneous tissues, tend to run with superficial veins, whereas deep lymphatics run with arteries. The testis, thus, drains lymph to the para-aortic set of lymph nodes, since the testicular artery arises from the aorta. The scrotum, on the other hand, drains to the inguinal group of lymph nodes. The testis, unlike the scrotum, never drains to the inguinal lymph nodes. The clinical consequence of this is that a testicular carcinoma metastasizes to the para-aortic group of lymph nodes and never results in inguinal lymphadenopathy, unless the scrotum is also involved. A scrotal carcinoma, on the other hand, causes inguinal lymphadenopathy. What is the innervation of the testis? The testis is supplied by T10 sympathetic nerves. The consequences of this are twofold. First, it results in testicular pain, trauma, testicular torsion, etc., being referred to the umbilicus, T10 dermatome. Second, the ureters are also supplied by T10 sympathetics. Thus, a renal calculus may refer pain down to the testis, as is seen in classical renal colic. What layers does the surgeon traverse when operating on a testis? Skin. Subcutaneous tissue, containing dartos muscle. Colles fascia. External spermatic fascia, external oblique. Cremaster muscle and fascia. Internal oblique transversus abdominis. Internal spermatic fascia, transversalis. Parietal layer of tunica vaginalis. Visceral layer of tunica vaginalis. Tunica albuginea of testis. For more MRCS Part B resources, please visit mrcsbites.com.